Hi everyone, my name is Martha. I'm a relationship counselor and clinical sexologist. And last night I came across an online article that has some questions. So I will attempt to answer it in this video. And let me show you the article. It's on the Independent. It says, I have a higher sex drive than him, not sure why he's not keen in sex. So two people seeking advice. I believe both of them on NUS Whispers. I believe they would have graduated. So the first case, this person is 24-year-old dating a 29-year-old partner for 1.5 years and bought a home. The relationship goes smoothly. They're loving, except they're concerned about one thing. Probably had sex less than 10 times over the course of our relationship. Most of it happened at the start. And the last time was probably 5-6 months ago. The partner is, boyfriend is tired, often tired from working 12 hours a day. And the last time they had was a bit reluctant. So both of them recognize that she may have a higher sex drive, but or maybe the work is just not demanding, and not sure why he's not keen to have sex. So this is making her feel insecure and not attractive to him. So the second case, a person has a similar complaint. The relationship is been 5 years, suspecting whether he's gay or asexual because they never had sex. They were sexually intimate at the start of the relationship. After that, it stopped. I don't want to judge him, but is it normal for the healthy young man in the 30s not to have a sex drive? So not sure how I can continue in this relationship like this. So several of the comments, I'm not going to go through all of them, basically essentially just said, just ask him like what's going on. If the answer, you will know, from the answer you will know what to do. And then one said it's probably because this person has a lower sex drive and you should just talk to a counselor about this. It may not be he's not interested in you. Sexual preferences and sex drive are important. Okay, so or some men are just born like this, not keen in it. So this is just the end of the post. They just posted some of the comments. And so let me answer what I feel needs to be addressed. So it's common to start to feel unattractive and to look at yourself and blame yourself about the lack of or the reduced sex frequency. The first thing I would ask as a sexologist is how often or if this person is masturbating. And if this person is masturbating by themselves in private without their partner, whether that is because it's a sign that they are actually having a sex drive. So they have a sex drive, but they may not want to have sex with their partner. And so that masturbation frequency is already an indication of the innate frequency of their sex drive. So I will ask questions around how often they masturbated and whether there's been any change, what's their masturbation pattern, how they masturbate, and what they think of sex. How easy is sex with the partner? Because sex by yourself and sex with a partner is actually quite different. So a lot of people prefer to have sex by themselves because we are used to being sexual by ourselves. It's just easy. It takes less time, less effort, but that by itself is an indication of their innate sex drive. The next thing I will explore is the relationship, the communication, and like the people in the question said that the relationship is fine. So that's something that I will already rule out. What I would ask is whether they may have some religious guilt. Some people, because of the attraction, they are okay to have sex in the beginning of the relationship, but the religion, the guilt of sex can set in. So that is something to explore because it was not mentioned in the article, so I do not know. That is also something to explore. And also, when you are together, are you together for the right reasons? What is their sex attitude? What do they think is the role and the importance of sex? So when I say together for the right reasons, what I mean is some people, they are just busy with their lives and tired, and so they just want their partner to be there as a placeholder to be able to take and check all the boxes, rather than actually look at ways that they can be pleasing their partner, because that is actually another area of their life. And so maybe they're wanting to do well in all the other areas, all the other boxes, but this area, you just stay there, okay? Don't rock the boat. So are they there for the right reasons? Meaning, like, are they just seeing you as somebody who is a compliant companion, like just keep quiet? And of course, that's not fair. But you need to see like where they see you fitting into their life, and like how much priority are they giving you. So I would really say that for the most part, it is true. All my clients who come to see me who say that they're busy, tired, stressed, I would believe him. It's true that he's busy, but working 10, 12 hours is not sustainable for a long time. So what is your partner doing when he's not working on the weekends? How are they replenishing their energy? And where do they place like you in terms of the sexuality and connecting as a couple as well? So some couples actually need some support in prioritizing sex to make it possible. So I actually do brainstorm with my clients around time management as well. Okay, so another thing is in a lot of long-term relationships, a lot of guys feel it, but they do not know how to say it, and they do not say it because they are afraid of hurting their partner, which is at the start of the relationship, they are very excited, they are very attracted to the partner, and they are still attracted, and they still love, and they still want to keep you in their life, but they are just less excited, less attracted to you. So what happens is that the honeymoon phase is over. So when the honeymoon phase is over and they're feeling less attraction, they may be doubting themselves. I'm really feeling less attraction. I am not sure what I'm feeling is what I'm supposed to be feeling. And I don't know how to tell her. And I feel that it's very unfair for her because she did nothing wrong. So I want to know you to know that this is a brain chemistry thing. The chemistry in our body actually changes over time. It's not that you're not attracted anymore, because there is attraction. It's almost like caffeine, because it has been scientifically researched that there is a release of the chemical in our body. And what happens is over time and exposure, you kind of, you're still getting the release, but you're just feeling the release, as in the hormone is still being released, but you're feeling less of it. You are less excited by your partner. So this is a time when the relationship is having the stability to actually explore what other ways can we spice things up, literally, like how can we infuse passion and excitement so we can continue to grow as a couple, having had that foundation. I think a lot of people actually do not take responsibility and accountability for it, and they do not talk about it because they're afraid of their partner's reaction. So the next thing is, next possible reason, and there are many, is that unfortunately it's probably a gender thing. A lot of people that I know of who are men, they do not like feeling pressurized. The pressure, the asking, the pushing, feeling like you push and then I just want, like, I don't like being pushed. I don't like being told what to do, or feeling like I'm being told what to do. Like, this is a problem, this is the solution. Yeah, you know this is a solution, but you don't want to do it because you don't like the feeling of being told what to do, just like we didn't like how our parents, our teachers tell us what to do. And so there is a sense of like mass, but then this is another task and duty and chore again. So it becomes another like not sexy thing, and they don't want to do it because it's like it has become like a KPI, right? So life is really stressful enough, so for them to even think about it. So one of the things to really look into is the tone and manner in which you are talking to each other. Is there a better way of communicating about your desires that will not make your partner feel pressurized, that will not make your partner feel shut down? And in a lot of cases, my clients actually feel that when there's any kind of a shouting and raising their voice, even though you're trying to communicate your frustration and get the point across because you've tried other ways, is that actually what has happened is your partner can probably shut down even more. So when you realize that it's not helping, so it's really important to also get feedback on the way that you're communicating so that it can be more effective. What happens when the honeymoon period is over? There's the forming period, then there's the norming. So what happens is that they are now focused on other things. They are genuinely busy and tired and focused on other things. And some people are not very good at multitasking. So they are so absorbed in what they are doing 10, 12 hours, and then they're so tired. So usually it is the truth, but how do you work around it? So it's really important to understand that life is not one-dimensional. We are multi-dimensional people, and we have many things going on in our lives. So it's really about managing our energies and our time and prioritizing it. So this is where I work with my clients with brainstorming, as I mentioned. So making sex a priority is important. And contrary to what people think, having spontaneous sex, men are supposed to be horny. I think this kind of gender roles is really not helping the situation, because all of us have a finite amount of time and energy, and different people deal with stress in a different way. So really being able to be supportive and saying that you have been patient, and I really think that we should seek help, because I can't do this alone. I have communicated my needs and wants, and I really don't know my way around this. Let's go to somebody else who's a third party, who's trained, who's experienced, and let's go through this together as a couple. I think that might be more productive. And to not think that when you go to a counselor like myself or a sexpert like myself, that we are just going to listen and we are going to judge. We're here to support you, and that includes going on the journey to help you to better understand yourself, your needs, including the communication that will work better for you. Having said all this, I want to say that a lot of times men that I know of through my work, they may be avoiding sex because they are experiencing sexual difficulties, and they do not want to face themselves. They do not want to accept that they have a sexual difficulty, and they are trying to figure out themselves. They are not knowing what to do. They are feeling confused. They might be frantically doing research on the internet. That's why they may be telling you that they are doing things, but it seems like they are not doing things. So they are trying to figure things out and do things in their own way. Many of them being like keyboard internet search engine warriors. But the sexual difficulties can be a reason why your partner is avoiding sex. So the sexual the lowered sexual attraction can be linked to sexual difficulties, and then they can get confused, and then they might be avoiding sex altogether, or they may have like accident happen or something happen, this thing happened, I don't know why it happened, I was not able to keep my erection, and then they get all anxious about it. And rather than the worst thing than facing you is actually facing themselves. They are actually running away from themselves. And so this is actually pretty devastating for them. And I do work with clients on developing more erection and ejaculation confidence as well. So I hope I answered this as fully as I can. So just to repeat, first thing I would do is I'll do an intake, and I will ask the client about their sex drive, and a big sign of it is linked to whether they're masturbating, how they're masturbating, and whether there has been any changes. I will ask them about their lifestyle, about their diet, or ask about the religion. I will ask them about the attraction, about the communication in the relationship. I will ask them about whether they are somebody who essentially doesn't like being told what to do. They are finding that this way is not working. I would also look at where the headspace is at, whether they are really focused on their career. I would also look at the way that they are managing their time, whether they are seeing sex as a priority, what is their sexual attitude. I would then also look at the sexual difficulties that they might be experiencing, whether they have any challenges around that erection and ejaculation. And it also can be that one incident that happened that actually has led to all these things happening. So I hope this video has given some insights. This is a little like glimpse, snapshot of what I do. Hope that you can also see that there's really no point in suffering further. A lot of my clients actually are in committed and loving relationships, and they will come and say that everything else in the relationship is working really well except this issue around sex, because sex is a topic that is quite sensitive, it's taboo. We don't have a lot of experience and expertise around it. So we struggle around this awkwardness and the communication around this. So all the more getting support earlier is better than getting it later, because when there's so much of resentment and history and baggage, it becomes really difficult to navigate through it and to really believe in the goodwill of your partner, in the love that your partner actually really has, but is not expressing through their body. So this has been matter of Eros coaching, and I want you to know that it's really important also who you ask these questions to. Like, try to crowdsource your answers from people who are not trained is not necessarily the best thing. The advice that you're going to get is really dependent on who you're asking the question to. You are going to get very different answers from a sex expert, a sexologist, and men on the street. Well-meaning as they are not trained, and sometimes the advice can really be quite hurtful and in fact damaging as well. So do take care out there.